here we go. So why are we talking about dry eye today? This is obviously will be one of the few seminars we'll be delivering at iClinic London. Just want to see, I'm gonna start from here. Okay, so we will try to cover the common topics. I've got a lot of emails, questions. Patient asked me about something to do dry eye, refractive surgery, ocular surface disease, lens surgery, and a lot of things. So I'll try like every few weeks to run one of those seminars where we answer your questions and try to give you a bit brief about the topic itself. So I chose to talk about dry eye as a seminar just before Christmas because I think all of us now start to feel the burden of dry eye because we're using screens more and more. What I'm going to cover a bit of some facts, the diagnosis, management of dry eye, and why you probably want to choose MyClinic London to have your dry eye diagnosed and managed. This is a QR. Feel free to take us turn your camera on and take a screen of that. It just gives you a link to my website where you can book appointment if you want to have your eye checked or have any more questions. So just some facts, and one of it that's probably you heard or you know that dry eye is not rare actually. It's a very, very common disease. And also not everyone gets some symptoms of gritty, burning sensation in their eyes necessarily have a dry eye. Actually, the majority of patients have more or less different degrees of dry eye disease. And this appeared in a paper a while ago talking about dry January doesn't end on the 31st for 5 million people in the UK, and that's a really rough estimate. Some other estimates go more. I just chose the more conservative figure. So 5 million people in the UK suffers from dry eye disease. And so that tell you the fact, which is actually shown through many studies, that the disease actually is underdiagnosed. There is a lot of patients with dry eye disease, simply they're not diagnosed or didn't have the right tools, someone guide them through what can be done. Because a lot of times dry eye disease can be easily managed without having too invasive treatments. Other times, obviously, you need more. And this is some of the question people are told about, or some of the theories about dry eye. Simple thing, maybe I have a dry eye. You go to a lot of ophthalmologists, optometrists, and a lot of statements you probably hear. Your eye is not dry, it's fine, it's all in your head. I'm not sure, you're fine, and all these terms. And this is the big one here is just you need more sleep, as you can see, or maybe you're pregnant. So a lot of, if you do Google search of the common words said about dry eye, you find a lot of those. Obviously, there is a lot of remedies for dry eye, but it's difficult sometimes to achieve a cure. There is definitely ways to make dry eye better by trying to find out what causing dry eye and by having the right tools to manage it on a long term. And the big dilemma with dry eye, actually, there is a mismatch between the signs and symptoms. And that's why sometimes the diagnosis is either wrong or is not reached easily, quickly enough. So for example, you might go to your practitioner and say, well, my eye's burning and gritty. These are symptoms tell me that you might have a dry eye. But when we examine the eyes, we find the eye actually is completely fine, absolutely no signs to suggest there's dry eye. But does it mean you don't have symptoms? You do. This is about dry eye. There is a mismatch. There is a lot of the unknown about the disease, and there is a big mismatch between the signs and symptoms. And today, you smaller group of patients here, but in fact, the larger group of patients with dry eye, they know a lot of information. There's so much about dry eye in the social media, in the websites, and a forum, and so many zones here about dry eye. And I have to say, a lot of it give you a lot of support to dry eye patients. However, some will have a lot of misleading information. So you have to be very careful. These are not doctors advising. These are people exchanging ideas. Yes, a lot of it could be supportive and give you a lot of insight about what you can do to manage your eye disease. But please check everything carefully before you just try to yourself. So some of the symptoms, to be honest, dry eye can give you any symptoms. So could be just a red eye, could be an itchy eye, you might feel some grit in your eyes. You might feel that you want to keep your eyes closed all the time. Um, Going in the winter now, walking out, you find the irritation, you can't keep your eyes open in the winter. So there's so many manifestations, even watery eyes. And that's surprise patient when we tell them, they come to me, say, I have a watery eye, and I said, actually, it's a dry. And that's a bit of surprise because, oh, I thought I have a watery eye, but actually, this is a reflex watering. This is not the essential basic tearing of the eye. So, and this is like three examples, and you can see a bit of description on the top, and the bottom show you some of the clinical pictures. Sorry for the images if it's a bit disturbing, but just to show you, for example, on the left, this is a lady, she's 36. She had a classical, what you call meibomian gland dysfunction. This is an inflammation of the glands that produce the oil and that's sitting inside the eyelid, lid margin. And you can see here, I don't think I have a mouse here to show, but on the left, the lid margin, you can see those small secretions. It's a thick oil coming from the glands. This is not an oil. This is a fat. This is a wax there. And the bottom picture with the blue light, this is a picture, all that green stuff, this is a staining on the cornea. These are all minor scratches on the cornea. That's quite extensive, actually. And for that lady, actually, nothing helped. The only couple of things might help her condition was the IPL, which I'll talk about later in tense pulse light, and the manual expression, which she comes frequently to my clinic to have it done. And the second example, for example, this is in the middle, 70-year-old gentleman. He had a cataract surgery, completely fine gentleman, no symptoms at all, but suddenly they found refractive surprise. What does it mean? They found that he can't see very well after the operation. And that was shocking because he thought that cataract surgery will improve his vision. Why this happened? Because actually all the measurements to calculate the lens power, to plan the surgery for cataract were kind of wrong, because look at the surface, that green staining of the cornea, there's no way you can capture a true measurements of the surface of the eye, which will help you to calculate the lens power when you implant in the eye. So you can't do a cataract surgery, a refractive surgery of any sort without having addressing any dryness of the eye. And on the right here, you can see, I'll just minimize the window here. You can see this is a patient. This is a common cases come to my clinic. Young patients underwent laser surgery, LASIK usually, and a typical case is not in the first few months because you've been assured and given all the lubricant eye drops. It's usually a year to 2 years when you come where your vision is amazing, but I can't open my eyes, doctor. I have to keep them shut, closed all the time. They're burning. My life ruined, and so many sad stories I have to say. The dry eye disease ruined the life, the social life, the jobs, and all let's call it even affect the family and all that. Now, when we look at those patients, for example, I'm still talking about this young patient coming after LASIK. This is the eye, when I look at it, looks fine to me. There's nothing really wrong. There is no staining of the cornea. It quite look healthy tear film, we call it. And tear film means measuring the thickness of the water on the surface of the eye. So what's that? That is a dry eye. But here is the problem is the nerves. The LASIK has damaged corneal nerves and resulted in a dry eye disease. So there's a lot here. So dry eye, one might look on the surface, is just a lack of water. Actually, it's much more than that. Because guess what? Your tear film, this thin layer, which is only 5 micron covering the cornea and the conjunctiva, the surface of the eye, this is your bloods without the red blood cells. So this is a clear blood on the surface. And imagine what the blood carries. You got all type of hormones to help the growth, the healing, stop inflammation, help blood vessel to stop growing. There's so many molecules in that tear film. So it's not just a water. Yes, it got the water to dissolve all this component. It's got an oil sit on the top to stop that water to evaporate, and you got a bit of mucus to help that water stick to the surface of the eye. But you can see in this image here, I put it to see how complex. There's so many factors influenced from the hormones, the central nervous system, your nerves, your hormones. So that's why emotional status affects your dry eye. homeostasis cycles, hormonal cycles affect the dry eye. There's so many environment, there's so many effects on dry eye. And this is just a small video display. It shows you that how that tear film actually, it's a pool of molecules on the surface of the eye, and that only 5 micron. So basically, if someone just blow in your face, or if you have a windy, you walk out in the wind, that will evaporate before you even thought about it. It takes less than 1 second to evaporate 5 micron thick tear film. And you can see those glands inside the eyelid. They produce that oil. With every blink, this muscle in red massage the glands, and the oil just come out from those glands. Look at the oil come out and spread on the eye surface. So you need to blink. I need to blink well to get all that product, the oil, flowing through the glands on the surface of the eye to stop that water to evaporate. And that's when we said meibomian gland dysfunction. We're talking about the glands produce the oil, which are 30 of them, 20 to 30 in each eyelid. They produce that oil to help the surface of the eye. This is not the lacrimal gland, which should produce water. These are tiny tubes inside the eyelid which produce the oil. And this is on the bottom left, you can see those are the tube of glands, which obviously don't see it, but they open just behind the eyelashes. And that's one of the things I tell the ladies when they come with putting makeup, to please avoid putting any eyeliner. That's you block the glands when you put it behind the eyelashes line. So the eye, actually, there's many fascinating facts about the eye, especially when we talk about the eye surface. So you know that between the blinks, we have every 7 to 8 seconds, we blink once. So you have like 10 to 12 blinks per minute. And if you don't blink that much, that means you're not blinking enough. And that's exactly what happened with digital eyes training, where actually when you concentrate on screens, on reading or whatever, you don't blink. The brain tells your muscles, stop, I don't want to blink, I want to concentrate, I want to see, so I don't want to close the eye. And that's why when you read, there's inhibition of the blinking. So we blink millions of times. And how can we address dry eye? How can we manage it? We need to optimize the environment. So I'll picture, I showed you that pool. You have, there is a very amazing harmony and balance between all the molecules, and there are thousands of molecules in that tear film. So really, to treat dry eye, you have to restore that homeostasis, we call it, so the right balance, or I like to call it microenvironment. And I was the first one to call it microenvironment, because we realized actually this is the only way to treat dry eye. And that's why, for example, you see the patients with severe dry eye disease, they only respond to serum eye drops from the bloods, because that's the one got all the molecules to restore the homeostasis. So how we diagnose dry eye? Well, we moved, I mean, obviously we take a very good history, and taking a good history, very important. That's why in my clinic, every patient will have to have a very detailed history. We might look like, think, why they asking me all these questions? Very important, because we will identify some environmental factors really affecting your dry eye. And we by just addressing those small things, suddenly you find actually your dry eye better. Could be something like your environment, where you work, where you live, your habits, smoking, what you use, if you work, you wear contact lenses, your pattern wearing contact lenses, conditions. There is a lot of systemic conditions affecting the eye. Actually, in fact, the eye is that weak organ in the body where if you have a dryness or immune disease, it's one of the first organs affected, simply because it's vulnerable. Is the cornea exposed? That tear film is very thin. If you lost it, your cornea suffers, and then you got all the signs of the problem. We ask your medications. You see a lot of patients, beta blockers. I've got a gentleman come said, I have this dry eye, it's been annoying me, and he's an older guy, very pleasant, but he really suffering now. He said, I'm struggling now to my work. I can't do my screen. I use a lot of screen for my job. Guess what? He had the beta blockers almost 12 months ago, and that's where started all his eye problems. So stopping beta blockers, I'll speak to GP to change it to something different. He's better. He took it for blood pressure. Now he's better by just trying to see what medication. That's why we're taking very good history, because that's important to us. And these risk factors, they coming, which a list you see in front of you, it's come from hundreds of studies called epidemiological studies. People looked at what risk factors, why patients develop dry eye. There are things you cannot change, you call non-modifiable, the age, the female sex, the Asian race, the fact you have MGD, those are, you can't change it. This is part of you. But there are a lot of things we can change it, whether it's to do with hormone imbalance, your habits, environment, some diet you're following, say something like immune related disease we identify, we can work around it. But there's so many things that actually in your hand, you can change it from the diet. And I'm sorry to say, our generation and the younger generation, sorry, the younger generation, they follow a very strict diets in various ways. And I have to say some of those are a bit crazy diets where actually you deprive your body from some essential elements. Guess, for example, some of the vitamins D and A, you need it to have a proper ocular tear film. So there's so many things that you can address to help dry eye by addressing those factors. Guess what? Now there is what's called emerging risk factors. We never seen children with dry eye disease. We see them now because guess what? Everything now on screens, on the tablets and iPads. The teaching education happened through the screens, computers, iPhones. Obviously, everyone holding iPhones now from younger age. We know the climate change. There's a lot of environmental factor affecting what we do and how we do. So we're seeing younger patients. I mean, dry eye used to be, it's a disease for female age 45 plus. That's a textbook. But reality now is different. Younger patients, more active people at young age developing dry eye. And the list goes on and on. Look at that. It's crazy. I mean, we call some dry eye. Patient have a LASIK. Patient has sometimes have a cataract operation, end up with dry after that. A lot of surgery can lead to that, and a lot of medication, as you can see in the right column. So we'll ask you question because they found one of the important tools to know where are you is to ask you certain question is to do with your lifestyle, how the dry eye affecting different elements of your life. And that's help us to diagnose where are you on that scale of severity of symptoms here. And blinking, I mentioned blinking is very important. And I tell you something that really, really important. People don't realize that actually blinking is important to have a good spread of tear film and to squeeze those glands in your lid margin. I hope this video will work, but it really show exactly what, look at, this is slow motion. Do you see that she is not blinking her eyes fully? That's called blink lagophthalmos. Then suddenly on the fourth or fifth, she squeezes her eyes because then the brain told her muscles, oh, we need more blinking. Another lady, look, there is no full blink here. So she tried to blink, but the bottom part of the cornea is always exposed. That is called blink lagophthalmos. Very important. And if you have a drops and all sort of treatment for long, I have those patients treated for a long time with various type of treatments, but the answer is simple: they don't blink enough or well. Don't confuse that with digital eyes training. We all have digital eyes training. We work hard, we spend time, especially now with the COVID, people spend more time on computers. That give you some eye symptoms. It doesn't have to be dry eye. It could be just a bit of imbalance of that tear film, give you that ache, especially that when you use your muscles, you focus so much, that can give you those symptoms. So just to quickly tell you what we do in the clinic. So when patients come to the dry eye clinic, we really look carefully. It's not about just a history. I pick up all the signs that it helped me to know where are you in dry eye, what type of dry eye do you have, and how can I help you? Because dry eye is not just one day. Dry eye is like you say, I have a red eye, like I have a bad skin. Could be many things, right? Same thing. So there's a lot of variation. Look at on the bottom right, you see that red lines? This is a device which measure, and right, top and left. This is a device we have which measure the thickness of that called tear meniscus height. That meniscus, that is the tear film. This is a very thin layer of the tears that is ready to go for next. That's a volume of, we measure the volume of the water in your eye by measuring this. And we measure it very accurately with microns. And we have various tools. In the bottom, you can see we measure the thickness of that lipid layer you have. Obviously, thanks to technology help us, which we have in our clinic to do all these measurements. We measure osmolarity. What osmolarity? Sometimes you're fine. People say you have no dry eye because everything is fine. There's no signs on your eyes. Guess what? We measure the osmolarity. Someone tell me, how salty is your tear film? In other words, say, how many proteins, how dense are the proteins, toxic ones, not the good ones, in your tear film? And that's usually, if you have a high osmolarity, means you have an inflammation in your tear film. And you hear me saying word inflammation, we're going to talk about in a second. There's other ways. So this is I mean non-invasive. I try as much as we can, because we found this is more reliable measurement, is to measure all the parameters of the tear film without touching the eye itself. That gives you the most accurate. This is a real life, more than we start to irritate the eye and we get error in the measurements. We do mammography. Mammography is really the only tool that show you these. You see those white tubes in the glands on the left. This is acceptable. This is a meibomian gland. You see 20, 30 of those glands got the oil that produced by the glands and leaked in the pool of the water. Look at on the right side. You see black spaces. This patient lost some glands. Not only that, the other glands are short and not as good as the one on the left. That is something you cannot see it with naked eye. You need special devices like this called mammography to measure to see where's the glands. And this is a good way we can tell you where is the problem. Because guess what? There's one of the things done frequently. People tell you, oh, go do lid hygiene, a mask, massage, you get better. But if those glands are blocked, those glands does not exist because there's no glands, actually wasting your time. There's nothing to express. There are treatments we do to help to get the glands function again, or see more glands appearing again so they're not died off. And when it comes to management, very critical to see. One of the examples I've got many patients come say, I tried everything, did not help. Yes, but actually the way they tried things randomly, you should have a systematic way to treat dry eye disease and to go from step to 2 to 3 to 4. So one of the things you heard me saying in the clinic, okay, we're going to stay with this is like stage 1, first step. If it doesn't work, I go to the next level of management. And that actually helped me not only to treat you and get you off top of the disease, but actually to eliminate those cases that actually need a little bit more treatment, more than the usual. And sometimes actually suddenly you find the diagnosis appear when you try to treat in a way to tell you where actually is a disease, what element of the tear film that is damaged or affected. And the simple management it's the start is a lot of it about, as I said, educating you, elimination of the environmental factors, things that really upset your eyes. We tell you about your diet, tell you about your habits, and a lot of things. We spend time with you. I have a good team. I have my optometrists. They are really highly trained to treat dry eye. So they're not less than myself when they come to see you and manage you with dry eye, because they got the knowledge and they've seen hundreds and hundreds of patients with dry eye. So that's how we go from level to level. And I don't go to details here, but just to go step and step. Always we say heated mask and massaging, very useful. On the bottom, brushing the lid margin for certain cases. This is not just, I don't like just brushing the eyelashes, doing like a placebo treatment. If you need it, because I can see a reason for that, we'll do it. Otherwise, we don't want to waste your money and your time on treatment that we know is not going to work. So we don't offer you something just experimental. It has to be based on where I believe it works for you. One of the things that really patients find very helpful, it's expressing the glands. Not very pleasant, but actually it's a very useful tool to do it routinely to get the oil out of the glands. And we have a lot of good tools helping with us. So we have the MeeboFlow, and the MeeboFlow is just a device which help us to, okay, let me show you. This is interesting. This is just to show you, not very good before your dinner, but just to show you when I express the glands, when you have, I tell you, you have this waxy glands, what I see coming out of the glands. Actually, it's not very pleasant. It's not an oil. It's not a clear oil. It's a thick wax. Imagine how many millions and thousands of bugs lives on that, surviving. So the whole flora, your bacteria balance on surface is damaged. How you expect yourself not to have a dry eye when it's not only you don't have the oil, the clear oil coming, you actually have a pocket of bacteria flowing, and it's not the normal, it's the disease bacteria, not the one that good for us. So so this is the Meboflow is another way. It's just it's to give you that good heat of the lid margin, and then we followed by massage. It's a simple, nice treatment. Takes 12 minutes really, but give you that there's no side effects. Very simple, really relaxing. Patient love it. It comes, but you have to repeat it like every 3 months because it just helps to melt that fat and then help it to express it out. What works very well, and I have a very good experience. In fact, I brought the first the light therapy machine. This is called the Intense Pulse Light. A few years back, we brought the first one to London, to UK. In fact, this is a light therapy. This is where we shine very bright light around the eye to obviously you protect the eye first, and it's this device particularly called the EI, but there is many other devices, and each one gets its pros and cons. So this is one of them called the EI Intense Pulse Light. So a lot of gel because you don't want the heat to affect your skin. And then it's very simple. Just show you quickly how it's just a very, very, very bright light. And we do set number of shots, different intensity depends on your skin type and the disease condition. So it's not just a light and that's it. There is some parameters we use to make sure you got the appropriate treatment here. So once that's done, obviously, this is a treatment that's, sorry about the noise, the fan, but that's a light where you just flash there. So it's just a flash of light. You don't feel much, all you feel is a little bit of heat, but it's not really, so it's a heat, like you feel the heat, but it's a light therapy and it works so well, especially for MGD. Now, if this traditional simple treatment not working, then it's a biologics. And I'm really proud myself because from where I work over years, we developed this practice where we have access to many of the biologics where help to reduce it. And this is basically, this is a way forward. I think the future will carry on. We give you your plasma drops to use at home, not artificial tears, which are just a water in the eye. I mean, all the artificial you use, to be honest, patients come to me say, I use this, shall I change it? I said, it doesn't matter. This is masking the symptoms. It's not treating you. If you want a good tear in your eyes, you need plasma drops. You need a serum drops. And this can be taken from you, autologous they call it, or taken from someone else, bloods, and then made, we just spin it around and we get that serum plasma and give it to you. And in other advanced case, stop an inflammation is using amniotic membrane. You know, the amnion cover the babies in the womb. So that is on the bottom. You can see it. It's a sheet of the amnion, and it now is done as a contact lens. So you have it with contact lens on the eye to help. What help? It helped to break the vicious circle of inflammation. Because I just want to tell you here, dry eye disease is not just about water, it's inflammation. It's a chronic inflammation, ongoing inflammation on the eye surface. And that's why if you don't restore the balance, as you can see here, if we don't break that vicious circle of inflammation, which is going on and on and on and on, and nobody seems to know how to break it, we have to break it, and we break it by using anti-inflammatories. So we have to treat inflammation. And then long-term, we don't want just to get better for 2 weeks or 5 weeks, and thank you very much. We want long-term stability. And we told you that failure is not uncommon because we know cases can be complex and you need more than just a simple treatment. And just quickly to finish here to say the treatment changed now from conventional, where about give you water. Now we understand it's about inflammation, managing your meibomian glands, those glands function problems. And then we talk about restoring the volume of the water. So when you come to my clinic, expect a lot of this to be done, various investigation, diagnostic, we have a pathway, we know what we're doing for every patient, and this is planned even before you arrive to the clinic, we know what things are going to be done to you in that visit. So if you want more information, you can go to our website, eyeclinic.london.com. Obviously, you can have a question, I'll put the number at the end, but I would just want to, in summary, dry eye is not about just water. There is inflammation, inflammatory disease here, and a lot of times there's underlying condition causing it. Is more than one factor leading to it. Don't underestimate the role of the diet, the hormones, the environment, medication you take that can cause dry eye disease. And again, as I said, we have like, is it like specific treatment individual to every patient. We don't have the same treatment for everyone. Like you go to many practices, it's just a standard. No, it's targeted to your condition. And obviously, I pride myself that we develop the most new modalities and top advanced modalities in managing dry eye disease. So I finish here. I like this saying, which clearly explain the what is the tear film here. The tears are not just water. So here you can see the QR code. If you want to take a picture of that, to lead you to the page where you can register for appointment if you wish. If you have a question, if you want to book an appointment, you can always call us. Numbers here, or email info@icliniclondon.com. I will go to your questions now. Let's see what we have here. Okay, so let me see how to stop sharing. Okay, so here we go. Right. So thanks for nice presentation. Thank you. And okay, I've got some patients, someone asking specific question. I promise I'll answer those questions for you. If someone have a specific question related to their own condition, I'd rather you talk to you, because it might not benefit everyone else. But if something really benefit the group, I will do it. So simply, I'm gonna go this one, say, where are you referring to the MIEBO Thermoflow? So we do it at our clinic. So we have the MIEBO Flow device, which is very good. It helps the ocular surface, as I said, with the case with MGD mainly. Again, this is something have to be repeated. It's not just cure, it's a treatment. Especially if you say, I'm really struggling doing this mask massage every day. I can't do it. I don't have time. This is a very good, easy way to come. You can repeat it whenever needed, actually. Good. Serum plasma, because I've been asked many questions about the plasma drops. Just to say, plasma drops is not for everyone. And in fact, there is very strict criteria in NHS if you want to have a plasma drops. And unfortunately, I can see a lot of patients deny this treatment in NHS. Sometimes you don't need it, which is true. Sometimes you need it, but there are a lot of restriction, financial burdens, and all that. So it's not always available to patients. But definitely, I'm a great believer in plasma drops. And I think the future will give you that prescription of a drops that's called tear drops, that you can buy it, which got more than just water and various lubricant, viscous lubricants. I think there'll be more to that. The children get a dry eye, yes. The plasma drops is suitable to anyone. We have it, obviously. If we're talking plasma drop for a child, we don't take their bloods. Obviously, we take bloods from, there's a donors where the blood's treated, managed. There's a lot of tests done for those donors, and then give you so you use blood from someone else, plasma from someone else. Adults, grown up, depends. If you have, and this is a big mistake, you can't have plasma drops from your blood if you have an autoimmune disease. Otherwise, we're pouring the same immune molecules into your eyes. So you have to have some blood tests to show that actually you're fine. Then we can use your bloods as a tear drops. If not suitable, or you don't want, for example, then obviously you can have there's a source for using allotears. So these drops are not from you, from someone else. So it's been 40 minutes. I hope I answer your questions. Please, if you have any more questions, do call us or speak to us. More than happy. I just wanted to show you what we do in the clinics, why we are different. This come after years and years of experience and we established the first dry eye clinic in London. I don't know if it's in the country, but to my knowledge, in London, we first dry eye clinic in London, and also I've done it in NHS as well. Obviously, NHS works very well as well, but it's manned by nurses who are trained to do it. They don't have the access to some of the sophisticated stuff, but it's still very good service, and I pride myself we managed to do it. I wish you all good evening, and it's coming close to Christmas, so Merry Christmas and Happy New Year to you all, and hopefully see some of you soon. All the best. Bye-bye now.